The announcement that World Health Organization member states have reached a legally binding agreement to prepare for future pandemics marks a significant milestone in global health cooperation, one that deserves to be seen not only as a diplomatic breakthrough, but as a crucial affirmation of shared responsibility in an increasingly interconnected world. After more than 3 years of difficult negotiations, spurred by the devastating fallout from the COVID-19 pandemic, this pact signals a renewed and tangible commitment to learning from past failures and protecting future generations. While the world has often struggled to act in concert, especially under pressure, this agreement is proof that collaboration, though slow, is still possible when the stakes are high enough. What makes this development particularly meaningful is its depth and scope. This is not a symbolic resolution filled with vague intentions. Instead, the agreement proposes an ambitious and concrete framework to prevent, detect, and respond to emerging pandemics. Among its most notable elements is the establishment of a pathogen access and benefit sharing system, essentially a global mechanism for rapidly exchanging critical biological samples and data. This aims to ensure that new viruses and dangerous pathogens are swiftly analyzed and understood, enabling faster vaccine and treatment development across borders. The inclusion of benefit sharing also speaks to a growing awareness of equity, ensuring that all countries, not just the wealthiest, benefit from scientific advancements. In addition, the agreement underscores the importance of creating geographically diverse research capacities. This is a long overdue step toward decentralizing scientific infrastructure, which has traditionally been concentrated in a few wealthy nations. By building research hubs in underrepresented regions, the global community is investing in resilience and empowering local scientists to take part in global health efforts, which not only promotes innovation but also enhances early detection at the regional level. The agreement also proposes a coordinated global supply chain and logistics network. During COVID-19, the world saw just how fragile and unequal medical supply chains could be. From vaccine hoarding to PPE shortages, gaps in coordination exacerbated the crisis. The new proposal aims to rectify these vulnerabilities by promoting cooperation in manufacturing, storing, and distributing critical supplies. If implemented fully, this could dramatically improve response times during the next major outbreak and reduce the kinds of geopolitical frictions that plagued earlier responses. One of the most forward-looking aspects of the deal is its call for stronger and more resilient national health systems. Global preparedness depends not just on science or funding, but on having healthcare systems that can absorb sudden shocks. Encouraging countries to invest in public health infrastructure, community-based care, and universal access to health services is a strategy that pays off not only during pandemics, but in everyday health outcomes. It speaks to a deeper understanding that pandemic prevention isn't only about vaccines and lockdowns. It's about building durable health ecosystems that can bend without breaking. The significance of this agreement is amplified by its timing. With multilateral institutions like the WHO under intense political and financial pressure, especially following the U.S. decision to withdraw under President Trump, this deal shows that international cooperation doesn't have to hinge on a single powerful actor. While the absence of the U.S. from the negotiations is regrettable, it also throws into sharp relief the unity shown by the rest of the world. The 194 WHO member states demonstrated that the health of humanity cannot be held hostage by the politics of any one country. The accord is a clear message. The commitment to multilateralism is alive and well, even if strained. Critics will rightly point out that any agreement is only as strong as its implementation. Signing a treaty is one thing. Building the mechanisms, funding the operations, and enforcing compliance are another. But this milestone shouldn't be dismissed on that basis. The act of reaching consensus among nearly 200 countries, many of whom have competing economic priorities and vastly different political systems, is an achievement in itself. It creates a legal and moral foundation from which further cooperation can be built, and it will hold countries publicly accountable in ways they were not before. The agreement now heads to the World Health Assembly in May for further consideration. There will be debates, objections, and perhaps some revisions. But the momentum has already shifted. This is a moment when nations stood up to say that the lessons of COVID-19 will not be forgotten. It is an example of progress born not out of crisis alone, but out of sustained effort, negotiation, and vision. In a world increasingly fractured by nationalism, resource competition, and ideological divides, this new pandemic agreement offers something rare and deeply needed: hope grounded in action.